Well, happening right now, a CDC advisory committee just recommended booster shots for certain people who are considered especially vulnerable to COVID-19. Latasha Givens answering your top questions about it tonight.
11 yeses, 0 no's, and the ayes have it, and the recommendation is adopted.
Yes, I have the same thing. The motion passes.
Friday afternoon, the CDC's Advisory Committee on Immunization Practices voted to recommend COVID booster shots for people with compromised immune systems. The FDA granted an emergency use authorization for this, but the CDC director still has to officially sign off on it. One question many of you have is who is considered immunocompromised? Well, according to the CDC, that includes people who have cancer, AIDS, HIV, kidney disease, transplant patients, and others with rare diseases. That amounts to about 3% of the U.S. adult population, but the CDC says that group makes up about 40% of the current breakthrough COVID cases.
This is a momentous decision, but it supports what we were expecting to happen.
Dr. Raymond Rubin, the chief scientific officer for Piedmont Healthcare's Transplant Institute, says this move is life-altering for his patients.
For our patients, it will provide more confidence that they get the same benefits out of the vaccination.
Another question people have is why the CDC director needs to sign off on this since the FDA already approved this yesterday. Well, the simple answer is to follow protocol. The CDC officially gives its recommendation before booster shots are distributed.
But now what that does is it takes this research and allows us to implement giving these third vaccinations out in the real world.
This booster shot recommendation only applies for the Pfizer and Moderna vaccines because there's not enough data yet for the Johnson & Johnson. That leading people to ask if they can get a different shot from their first two. The advisors say yes, but with conditions.
Alternate mRNA product can be used if primary series product is not available.
In order to get the third dose, patients will need a prescription showing they are in fact immunocompromised.
Nearly 1 in 4 hospital patients in Georgia are battling COVID-19. The latest White House report ranks Georgia as third worst for COVID hospitalizations. And our daily numbers are telling a much different story compared to just 1 month ago. In early July, Georgia saw about 540 COVID patients per day. Today, that number is above 4,000. That's a 655% increase. Only 41% of people are fully vaccinated in Georgia. That means more than half of the people who are eligible still haven't gotten a shot.